Today we have an important conversation because we actually migrating so kakra. How exactly do I know that I'm buying real pharmaceutical or fake ones when I go to try and get some medication? How do I know? How do you know? Today we are going to find a solution to the problem of fake medication because this thing kills. It kills, and we certainly don't want to have such tragic stories here in Ghana. To help us with this, Kwame Sapon-Asiedu is a D&D fellow on public health at CDD Ghana. He's a pharmacist. He's a member of the Royal Pharmaceutical Society of Ghana and the Royal Pharmaceutical Society of the UK, and also the Pharmaceutical Society of Ghana and the Institute of Pharmacy Management International. And he's here in the studio. We haven't had him in the flesh for some time. We're very excited. Kwame, good to see you. Thanks for coming.
Thanks for having me, and good morning.
Indeed, indeed. We also have in the studio the coordinator for the Ghana Pharmaceutical Traceability Strategy at the Ministry of Health, Mr. Festus Korang. You heard him on Tuesday. He's here in the studio in the flesh today. Thank you for coming, Mr. Korang.
Thank you.
And this time he joins us over the phone. He was in the studio on Tuesday. He is the head of enforcement at the Food and Drugs Authority, Mr. Vigil Edward Pra-Ishan. Mr. Pra-Ishan, thank you for your time and good morning.
Good morning, and good morning to my colleagues at the studio.
Fantastic. All right, we've got an important conversation. It comes up in just a moment.
So we've been speaking to you. We've been asking you that simple question: how do you even know that what you're buying, that medicines you're buying, are safe? Let's listen.
Since we don't have anything to identify that this drug is fake or not, because we don't have that much knowledge on the drugs itself, I think we buy any medicine that we think is okay. If you go to the drugstore and then you tell the attendant there, and then whatever they pick for you, just pick it up, because Standard Board have not even given us anything to identify that this drug may be fake or original. Do you understand? Like a seal or a sticker to show that, okay, if you buy a drug with this sticker, meaning that is genuine, or if you don't see the sticker or don't see this emblem or anything like that, then it is fake. You don't have anything like that. So just buy anything that we get. You understand? So far as it's work for me, so I'm okay.
I have to check the expiring date on it, yes. So that's why I look for the authenticity. You're also going through, like, sometimes you do a little research on it before you even get to buy it. And also, you have to get prescriptions, because you just diagnose yourself and go and buy drugs. So basically, mostly I look at the expiring dates on it.
Apart from the expiring date, at times when you hold it, it will break. It's not hard. So that's what I check normally. How the texture is. That's why.
Me, when I go to the doctor to buy medicine, I just check the date, whether it has not expired. Because I've heard somebody say if your head is paining, you can use maybe para or maybe Bico. It will help you to do this or do that. So if I go, I follow what my fellow will tell me, and I will also go and do the same. So I don't check the side effect or think that is going to affect me. No.
Normally, I check probably the brand of the manufacturers of the drug, and that's exactly what I check. So I check that one. When I think that one is okay for me, my brand is okay for me, so that's what I check.
Yeah, wow. All right. So the situation is real. It's real. Not everybody knows how to identify fake drugs. I certainly don't. And that's why this conversation is so important. Let's get to it. Kwame Sapon-Asiedu, Festus Korang, and Vigil Edward Pra-Ishan are our guests. And listen, today we're focused on the solutions. We're also focused on you. What questions and issues and problems do you have when it comes to medication, fake medication to be precise? Use the hashtag JoySMS. Start tweeting at us. We will open the phone lines in a bit so that you can call in with your questions for our guests. Okay, but let's get started. Today we want to focus on solutions. But quickly, let's try and understand the problem we are trying to solve. According to a report that was presented to the AFTA conference in South Africa just a few weeks ago, about 80%, according to their estimation, of drugs imported into Africa are fake. this is problematic. In Ghana, our own authorities suggest that it's about 45%. But according to the Ministry of Health, 10% of child deaths are caused by fake medication. That is serious. So we need to safeguard our community, our children, ourselves from what a fake drug can do. So before we get into the solutions, which is our focus for today, Kwame, tell us why it is far more serious than people might envisage. The fact that you could possibly buy a fake drug on the market.
Thanks, Kojo, and good morning to listeners. I mean, you basically need to understand how medicines work to understand the dangers of fake drugs. For every medicine, there's what we call the therapeutic window. And what's the therapeutic window? Is the minimum dose that would be effective, and the top of it is the maximum dose above which you get more side effects than the drug will give you medicine. So when you take any medicine, it should be within that window, just above the minimum, but below the maximum. When it comes to fake drugs, a number of things can happen. Often, they say about 30-35% of the time, you don't get the dose getting to the therapeutic window at all. So you are not going to get any management if it's a chronic disease or curation if it's an infectious disease, because that's the end target.
So it basically will do nothing.
It would do nothing. But what it can do, if it's an antibiotic, antifungal, or antiviral, is it can then lead to antimicrobial resistance, because you are introducing small doses of that drug to the microorganism, and the microorganism, just as human beings, is learning how to cope with the doses. So next time you give them the correct concentration, they are not going to react to it. And then cost of treatment goes high, because you'd have to go for higher end antibiotics, antimicrobials to treat the same disease. So you're shooting yourself in the foot, basically. So that's the first aspect. The second aspect is what we call dose damping. And what do I mean by dose damping? When you take a medication and it's formulated, it has to release at a certain rate so that you don't overshoot what we call the upper limit of the therapeutic window and get side effects. If that medication is not formulated properly, either it's not mixed properly, either if it's a tablet, it's not punched at the right punch pressure and stuff like that, the minute you take it, there's something called the disintegration time. That is basically when you take the drug into you, the time it takes for the drug to break down in your stomach and for it to be absorbed.
Okay.
If it happens too quickly, then it means the concentration in your blood is going to overshoot that therapeutic window, and you're going to get massive side effects, sometimes even serious adverse reactions. And there are occasions when people have unfortunately lost their lives because, like I always say, a drug has two definitions. A drug can be defined as a poison at low concentrations, and a poison is only a drug at high concentrations. So the same thing you take can either be a drug or a poison depending on what you're taking. And if it's a spurious medication, then you can't get that dose damping. The other thing is maybe it's a modified release formulation. Those of us who take things for diabetes, hypertension and all that would realize it's modified release, so it's got to release itself over 24 hours. Sometimes it's an immediate release, so you take 3 times a day and stuff. If it's a modified release and say it's got, let's say, 60 milligram of it in it, and it's got to last you 24 hours, you can work out how much it's going to release in every hour.
Yeah.
If there's a dose dump, you might have all the 60 milligram bang released immediately in the first 5 minutes because it's not being formulated properly. And if, say, you're expected to have, let's say, 5 milligram per hour over 24 hours, or 2 milligram per hour, or 2.5 milligram for a 60 milligram tablet over 24 hours, you can know what will happen if you have suddenly 60 milligrams shot into your system. Then you look at, so that is for the general population. Then you look at the population, what we call the at-risk population, children and the elderly. These have very compromised immune systems, especially with the elderly because of old age and their systems not working properly. And with children because these systems are underdeveloped, their organs and other things. So if you give them a substandard product, then these have a high probability of unfortunately losing their life. And that is why when Virgil said they are playing with a number of about 45%, and Mr. Crane said their records show that 10% of deaths in children is directly a result of spurious medication. The two correlate, you see, but the data we don't have is what percentage of those adverse effects like side effects, hospitalizations have happened as a result of these medication. So that is the size and the risk of the problem. But when you're looking at it like this, I always say that it's good to know the size and the risk of the problem, but how do we solve it?
Indeed, and that's what this conversation is about. I'm going to start with you, Mr. Krang, because your work is specifically to find a solution.
That's right.
You work with the Ghana Pharmaceutical Traceability Strategy Project at the Ministry of Health.
Exactly.
Tell us what that is.
Okay. Thank you for cherished listeners. And the Ministry of Health considered this as one of your corporate responsibility, and we are very happy about that you've called us for this particular program. Anyway, it is like you look at it globally. Ghana alone is not suffering. It's the whole globe in general. So we sat down according to the Minister of Health, because this is a strategy initiated by the minister himself. So we look at the global trend, and then we came out with a strategy how Ghana can also adopt the best practices in the world. So this strategy is has a 5-year implementation plan. And we look at business, finance, because this problem is not affecting only health, it's affecting our financing, it's affecting businesses, aside affecting the human health. So we look at it holistically from all these areas to come out with the strategy. For this reason, our stakeholders come from diverse areas, from the Ministry of Finance, from the GRA, then we look at our stakeholders from the manufacturing sector, we look at the private sector. Almost all these people were brought on board to come up with this strategy. And it has a 5-year implementation plan.
So what is the strategy? What are you aiming to do?
Well, first of all, the Ministry of Health has laid down a platform called Ghana Initiative Logistic Management Information System, GILMIS for short, and is to ensure visibility of medicines from the central level right down to the primary healthcare level, to the chip compounds, to the patient. And based on that platform, we decided that we have to build on it the traceability system. For the visibility, we can see where the medicine are coming from the manufacturer to the central medical store, to the regional medical store, to the facilities, right down to the lower levels. So being able to see how the movement of the medicines are, then we now have to come up with how we can actually ensure its efficacy that the people are taking. So the strategy actually has a 5-year implementation plan. Yeah.
So hold on a second. You know where the medicine is coming from.
That's it.
You can trace it right from the manufacturer to where it goes.
Exactly.
How about its efficacy, and how about making sure that, Kwame has been talking about everything, the therapeutic nature of it. Are you able to check all of that as part of the project?
Seriously, there is no way that you can actually go ahead of those producing this fake medication. What we are looking at is that if you know the integrity of the manufacturer, it also helps you to know what you are holding. That is one of the basic thing you have to look out for, the integrity of the manufacturer. Then after that, as Vigil came in, you do the post-market surveillance. Even though you trust the manufacturer, you still have to do the post-market surveillance to see that what they said they are giving you is what is out there in the market. So basically, this is one of the...
So you're looking at right from the central stores, you've checked all of that.
Exactly.
How about, the pharmaceuticals that bring them in and they get straight into the market? You're able to check all of that too?
I like this line of question. We spoke about visibility. Very good. You know where it's moving. Now, it's going to be, the strategy is said that it's like a channel where every medicine, supply chain channel, where every medicine that get into the system will have to pass through that channel. Now, the end result is that we're coming out of such a system that the end user can have maybe a mobile phone, dial a code, and see whether the person have to take the medicine or not. If the code tells you don't take, it means it didn't pass through the channel. We cannot stop all the people bringing it from various places. That one, but what we can do is to ensure that the one that is coming through the right channel. Yes, and then we will come out with an app. Then the app will actually help the consumer take or don't take. That is where we are going. But as to whether you should be able to get exactly whether the thing is fake or is also another level that after that we will get to.
So at the moment, what you'll be able to determine is that the medication in your hands came through the proper channel or it did not.
Exactly.
If it did not, then you have no idea what it is, whether it's good or bad. You have no idea.
Thank you.
But if it came through the system, then you know that it is good and safe to take.
Exactly.
Okay.
Exactly.
So explain the channel to us. What is the channel? How are drugs supposed to come into the system so that your system captures them?
Well, so the FDA is at the port. We have the GRA there. When the drug comes, they have to actually, the FDA is on top of it. Now, with our strategy, we have a system called Global Standard 1, GS1. They provide the codes, like the GTIN numbers, the global location number, and either barcodes that can identify the medication where it's coming from. For example, if you take your bottled water and you look at something will come out to tell you the manufacturer's name, where it's coming from, the expiry date. Now we want to add more to this system, whereby when it comes and the FDA is not able to catch it, the FDA is not able to arrest the situation, then everybody will know that this didn't come through the right channel, and therefore you don't have to solicit for it. So basically, that's what we're doing.
So you said there will be an app that
Yeah.
the customer can use to check each medication and ensure that it came through the right channel. So is the app already existent?
No. That is why the strategy has 5-year implementation plan.
Okay.
First of all, we look out for the governance because there should be people who should be in charge. Unfortunately, the Honorable Minister is the chair of the steering committee that's looking out for this. In fact, he doesn't give it to anyone. He himself handled it because he said he has been a victim. So for this one, he wants to make sure this strategy works. So the governance structure, we have a steering committee, we have a technical working group, and we have a whole secretariat also seeing to this. Then the next strategy is looking at the point of regulatory. Next is also looking at it from the whole supply chain system. Then we look at technology because we cannot do without technology. Technology is what we're going to base on. Then we are also going to look at the skill mix, the people who are going to work on this. For now, what we've been able to do is that we come out with the governance structure. We are now going to do the basic, look at the system. What do we have in the system in general? What is there? What is not there? What do our manufacturers need? What do our wholesalers need? What do the retailers need? What do our facilities also need? What gadgets do they need? So we'll look at it, get the cost of it, and then we can see where we have to start from. Because we can't just start straight away and say, look, everybody go to this system. It involves money. The manufacturers have to change their system because in that case, they need to put in more money. So for that reason, we have started now looking at basically what the system has.
So when you say it's a 5-year implementation plan, what you mean is that this system will be in place 5 years from now?
5 years from now, the end will be at 5 years.
All right. Well, if you just joined us, just to remind you, we're talking about fake drugs. Very serious problem. Across Africa, we're told about 80% of the drugs that come in are fake. Here in Ghana, we have quite a situation on our hands that we're trying to resolve. And helping us fashion these solutions, Kwame Sapon-Asiedu is a pharmacist, Festus Kurang, works at the Ministry of Health on a project to do exactly that. Vigil Edward Praishan is in charge of enforcement at the FDA. Now, this solution is 5 years from now.
5 years.
Okay, which means that for the next 5 years, we still have to somehow keep ourselves and our children safe. Vigil Edward Praishan is head of enforcement at the FDA. Now, in our conversations on Tuesday, it appeared that, well, the FDA is doing what it can. It's regulating what it can. It's doing market surveillance where it can. But the problem still exists. 10% of our children are dying from fake drugs. So, is it the case that FDA has done all it can and there's nothing else that we can do to keep people safe until 5 years from now we have this system?
Hello, Kojo. Good morning to our listeners. I think I need to correct something here. The last time I was there, I made mention of the fact that we have different failure rates for different group of drugs, and that the highest we've come across so far is around 45%, which for a particular group. And even the 45% that we're looking at or we're talking about is as a result of poor handling and transportation of this particular group of drugs from maybe the manufacturer to the final user. So it's not a total situation of substandard and falsified. It's rather more of poor handling, poor storage, and all that, which FDA is trying to work on. Well, if you look at other group of drugs, I said, for instance, anti-malaria that we use, which is very common, it's less than 1%. For antibiotics, we're talking about below 5%. So if you say 45%, it's making it look as if the total failure rate is 45%. No, I was trying to be specific.
All right. Thanks for the clarification.
Good. Now, coming back to your question, I think FDA, as we currently speak, has a lot of measures in place to make sure that the quality of drugs that we access on the market are of good quality and are safe. Okay, apart from the identifications. And the last time I was there, I tried explaining that before you bring in medicine into this country, first of all, must be a registered entity with the pharmacy council. Apart from that, you need to put in an application to the FDA. You come with it with all your supporting documents, with your samples. These documents will be evaluated and they'll be subjected to scrutiny. Samples will be taken to the lab. They'll be tested, and a team of experts will then review all the reports before a final approval is given. Even that, before you import the drug, you still need a permit. And this permit gives specifics. You are to bring this drug from the facility that we inform FDA of, that is the manufacturer. So you can't just register a particular drug and go and pick it from any other facility and bring it into the country. This is some sort of check that we put in place to make sure that the drugs are coming from authentic sources. And before we even give approval for any of these drugs, we do visit these facilities to conduct what we call a good GMP inspections, the good manufacturing practices inspections, to make sure that these facilities are up to our standards, before clearance is given. After the registration and after this permit system, when a product arrives at the port of entry, which have been limited to only two, that's Kotoka International Airport and the Tema Port, we have officers there, right? They pick samples, they check all the necessary documents. Where there's need to resample and test, we do. When clearance is given for these products to enter the market, we still do the market surveillance that my colleague Festus was talking about. We send officers out there periodically, they pick samples, we test, just to make sure that the quality is still the same. After that, we also have what we call the pharmacovigilance, which is also a sort of monitoring tool. We have what we call the adverse drug reaction form, placed at all hospitals and even some pharmacies, where cases of reported cases of adverse drug reaction will be reported to the FDA. We also have what we call the next CPR. There are a lot of measures that we put in place to pick information from the public, to work to ensure that the medicines that we handle or we use as Ghanaians of good quality and they are safe for our use. And just to add to what Festus said, the traceability system is all about data capture. What we're looking at is to have a master data point where every drug that will be in the legitimate supply chain will have will be inputted into this master data. So the master data will be populated by the manufacturer or what you call the market authorization holder. And each drug, per this policy, is to have what you call a global location number, which tells us where the manufacturer is located. It has a GP number, which tells us which is a specific number for this product. And it goes as far as having a serialization number, which is very unique to each product. So with all this information in the master data and the 2D matrix, the barcoding system that Festus was talking about, when we'll get to a level whereby just by scanning, you'll be able to tell whether this product is really a known product to the regulator or not, or if this product is supposed to be in the supply chain.
So, Mr.
If it's not supposed to be in the supply chain, there's no way that you find any information about it in the data.
Mr. Preshan, we understand how that works. I think Mr. Krang explained that quite clearly. But this is a solution that is 5 years away. So my question to you was actually whether there is more that the FDA can do. You've outlined everything the FDA is doing presently. But presently, if you take 10 dead children, one of them died from fake drugs. Even your parent ministry accepts that whatever we are doing today is not enough. So they are aiming for a solution 5 years from now. I'm asking that in those 5 years, what else can the FDA do to protect us? What else? You've told us what you're doing now. Is that the extent of it? Are there no conversations at the FDA about other things that you can do in the meantime?
Doing currently is to, create public awareness on this substandard and fortified medicine. We've had a program with the WHO. We came up with certain posters. We've had a lot of engagement with stakeholders and all that. And this we're still doing because it's our belief that by enlightening the populace, telling them what to look at for instance, if you're going to buy a drug, make sure that the physical look is as good as what you know. Is to check for the smell, is to check for information on the inner set and the outer set, make sure they tally. You should look at programmatic errors, spelling mistakes, and all that. These things
do you think the public are equipped to
yes,
to
these
make
are
these
physical
checks?
checks that you can do.
Grammatical errors in drug names and
identify a substandard or a falsified drug from an authentic drug. So this is something that we are doing. We are trying to, educate the public, create the awareness, so that the public itself can also identify some of these drugs that necessarily depending on the FDA. So apart from that, we have a lot of reporting channel. The public can also report some of these substandard enforcement medicines to the regulator for action to be taken. So for now, I think that's what we have in place.
Okay, but talking about, you've talked about a very formalized system, but the reality also is that not all the drugs that we find today would come from the Tema Port or the Kotoka International Airport. So how do you ensure that those drugs that come from unauthorized entry points into the country also meet all of these requirements that you're talking about?
Right, like I said the last time, we do not allow drugs to be imported into the country through all the other points of entry. Apart from that, we have our physical presence at this ports of entry. We have officers at Elubu, we have officers at Aplao, and all the other outlets that we have. So our officers are mandated to check every consignment that's coming to make sure regulated products are not allowed in when they are not certified by the authority. So that's these are some of the measures that we have in place as regulated.
All right. So let me bring in Kwame Sapon-Sido at this point. In fact, let's take a moment. Let's listen to our partners, messages from our partners. When we come back, we continue this conversation about fake drugs. We've heard what government is doing. There's a 5-year plan to set up a system that will ensure that you can tell whether a drug came in the right way or not. There's also the FDA that will continue to do what they are doing and enhance their public awareness in the meantime. Will that work? We're talking about fake drugs, trying to figure out a way to keep ourselves safe from it. So we've asked government, what are you doing about it? Ministry of Health says, we're working on a project. This project will make it easy for you to determine which drugs came in correctly, which drugs did not. Then you can, confidently take the ones that came in correctly. Problem is, that solution is 5 years from now. So what do we do in the meantime? Well, FDA says we've been doing a lot. We've been doing everything we can. So we do market surveillance, we check everything at the ports, we do what we can. We will increase the sensitization and awareness. We'll tell people a lot more about what they can do. They say they will help us spot red flags, if you will, on drugs. If something is wrongly spelled or it doesn't look, that what is inside doesn't look like what is outside and so forth. These are all red flags. So that's what FDA will do. Now I want to ask the pharmacist, is this enough? Will this satisfy, the need that customers have of knowing whether or not they're taking fake drugs?
Well, that's a very tricky question. And I say it's tricky because enough is subjective. I mean, I'll be the first to admit that even when you look at releases from the WHO or from the United Nations Office of Drug and Crime, the Africa Division in Dakar, you'd realize that consistently across the globe, there are releases around substandard medicines, even in very highly sophisticated markets. I remember someone brought up Rambaxi in the US. There've been some in the UK where Roland Kem also had issues, but that had to do with GMP practices as well. So enough is very subjective. What you can do is to bring it to the barest minimum so that there are things where you look at markets and they are talking that no more than 0.5 to 1% of all their medicines should have any of the categories of problems, whether it's fake, whether it's substandard, whether it's spurious, whether it's supply chain related, like Virgil was saying, because there are a whole range, like I have said previously. So currently, we do not have something like that in place. And like I always also tell people, a journey of 1,000 miles starts with a first step. So it's good that the Ministry of Health has taken the step. But then we're still at a point where 10 children are dying. It's a reality. And if you're a parent, like all of us are, the last thing you do is wish it on your child or your brother's child or your friend's child. So when I was listening to Virgil and I was listening to Mr. Kran, I'm someone who tends to think impulsively. I was like, okay, with my personal experience, if you gave me a box of tablets, maybe because I'm a quality control and biomedical professional, I can quickly tell you where this box has come from and whether it's manufactured, because there's a market authorization number on that box, which is a statutory regulation that every medication has to have. The FDA registers all drugs that comes into Ghana. So they already have a directory, because once they register it, from the monograph, they will pull all these information, the batch number, the market authorization number, the expiry date, and all that. They have it. The WHO also has a database. So does the MHRA in the UK and the FDA, and even the other markets like India, where we import drugs from. So I think as an immediate stopgap, okay, what if the FDA converted their register of products into a searchable tool, which is pretty easy to do with IT, and gave it to practitioners. Who do I mean by practitioners? Like me, a pharmacist, a community pharmacy, or a hospital pharmacist. So just as you have a Google search engine, if you, Kojo, came to me and said, I bought this product and I have suspicions about it, or even you, the pharmacist, got a product from your wholesaler or something, Phil, you can quickly type in the market authorization and see, is it on the FDA register? They can even augment the situation and have an enhanced register where they have the products that are on their register that they have registered. But if they know that a lot of their imports come from, say, India or for the European Union, they can also have the European Medicines Authority or the Indian regulators register as well. So if you key in and say it's come through our porous ports, it will tell you that, oh, this product is registered in India, but it's not registered in Ghana. For which case you might see that it might be a clone, or what do you call, like I was saying, a counterfeit, because someone might have made it in India, cloned the market authorization, brought it into Ghana through the porous borders, and then you as the practitioner can then aid the FDA by reporting to them that, look, I've got this product, I got it from wholesaler X, I can see that it's registered blah 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 in this country, but it's not registered in Ghana. Is it possible that you can actually do a second check? I may be getting it wrong. Because the point is, if I'm standing in a community pharmacy, it's so difficult, even with an expert eye, for me to tell that this is counterfeit, substandard, or fake. So if I have something like that, it becomes a tool that I can use. So I am sitting here wondering that, would something like that not aid my practice? And the answer to me is yes, it would aid my practice. And the other advantage is it would give organizations like the Pharmacy Council and even the FDA, who are the regulators in the space, the opportunity. For example, if you came to a community pharmacy and you have the database available and you said, oh, could I quickly have a look if you are using the database, and they are not using it, then you can challenge the practice in that pharmacy, because then you know that that pharmacy potentially might be putting their patronizers at risk. That's one thing. The other thing I can look at that quickly comes to mind is we have over-the-counter sales points. They are not supposed to sell prescription-only medicines. So Virgil is talking, it's a brilliant idea about public awareness. So the first thing you can do is, look, the public should learn, if you have a prescription, never take it to the over-the-counter point. And the reason is simple. They are not supposed to stop prescription-only medicines. So if you are buying your prescription-only medicines from there, you are sure they didn't get it through the supply chain Mr. Kran was talking about, because the wholesaler, ideally, if they are practicing properly, wouldn't sell to the over-the-counter person because it's a prescription-only medicine. So if you as a citizen then don't take your prescriptions there, then you also cut the tendency for them to be unscrupulous and try to buy the products, because they are not going to have their footfall coming in to purchase it. These are further things we can do. And so if these things are not in place and you ask me, have we done enough? I would, based on the broad pace I've said, not exactly, but are we getting to the point where we're doing enough? Yes, because I can clearly see a journey has started, and the footprints of the journey, as in that document, are clear to lead us to the point where we would do some of these things.
All right. Let's open the phone lines. I want to hear from you. I want to hear your questions, experiences, issues that you want to bring up with our experts. You know the numbers: 0302 216 541, 055 1111 997. While we're waiting for the first call, I want to ask you, Mr. Krang, what Kwame has described, that is really what your project wants to achieve, isn't it? But his description doesn't sound like something that would take 5 years. Looks like the database is already at the FDA. FDA is part of your project. Really, should it take 5 years to make that a searchable tool so that everybody, even customers, can access and check and see whether the drug they've just paid for came through the right channel?
We are talking about satisfying the whole populace. And if you are going to satisfy the whole populace, you have to take the whole populace on board. You just can't start a particular day and say, bam, we've started. No, it starts from somewhere. And
but
that
will it
is
take
why
5 years?
we have a lot of things to do. For example, I started telling you that currently, what do we have in the system? Currently, what do we have in the system? What do our local manufacturers have? What do the wholesalers have? What do the facilities have? We need to look at all what they have and then come up with a system knowing that, well, it will cost them this to get to this level.
Okay.
It will cost them that.
We'll get you to explain that a
Yeah.
bit more in a moment, but I don't want our callers to wait too long on the line. Mami is in Takrade. Hello, Mami. Good morning.
Hi, good morning, Kojo. Okay, so I
what's
have
your question?
a quick question. So I suppose clearly our FDA is not ready to take any serious action now. 5 years before we are able to get to a point where we can check if drugs we're buying are proper drugs or not. Here's my question. Do the pharmacies not have any responsibility at all to check what they are receiving from their wholesalers? Surely they must also bear, some responsibility. What are they selling to us? What are they retailing to us? Can they not invest in systems that will check what they're selling to us? This problem seems rather, scary. And I think that at least pharmacies, yesterday or the day before, I must have heard somebody on your radio station talking about an app they've developed, which they're using in Nigeria, which helps to sort of check these things.
Yeah,
I think the pharmacies should also, from their profits, invest in things like this. Thank you.
Thank you, Mami. Thanks very much. Kwame is in New Bawe. Hello, Kwame. Good morning.
Good morning. Yeah, I want to suggest something. You see, we have so many pharmacy schools now. We have KNUSC, we have Legon, we have Central University. So as part of their project work, let those who read pharmaceutics go out, pick drugs from the shelves, and do an assay or an analysis. And then, if there's any negative finding, they suggest it to the Food and Drug Administration to take care of those things. So the university education should not be just do some of the project work which we do, which have no relevance to the society. Thank you.
Thank you, Kwame. You can call us to 0302 216 541, 055 1111 997. We're talking about fake drugs. If you have questions and issues, our guests can help. Oko is in Kaneshi. Hi, Oko.
Yeah. Good morning.
Good morning, Oko. How are you?
I'm fine. On this discussion about the fake drugs. I thought Brad Simmons invented something some years ago, which most African countries are using. It is even going global. And I'm surprised that this topic has, you haven't even called him to find out how far.
Oko, we did call him. We spoke to Bright on Tuesday.
Say again?
We spoke to Bright Simmons on Tuesday on this topic. To Selon Brantier, who works with Bright Simmons. Forgive me. We spoke to Selon Brantier on Tuesday. Yeah.
Okay.
Thank you for calling, Oko. All right. Victor is in East Legon. Hi, Victor. Good morning.
Hi, Kojo. Good morning. Trust you good.
Yes, not bad at all.
Yes. I'm into the tech space, and I think as Ghanaians, we kind of look down on our tech industry a lot. I think some of these things, we don't need the whole system or whole investment to even get it done. We just need the data from the FDA to be out there, And if they're able to publish the data, we can just pick it up, create an app, and create a database where you can verify anything that has been registered with FDA. And this does not take even a year to implement. So I don't know if they want to reach out. I'm into the tech space, and I'll also go and look out for this data to get them something in the nearest future. But I don't think they should go up to a year. As Ghanaians, as Ghanaian tech industry, we're able to do it way better than this. So let's put that into consideration.
Thank you, Victor. I appreciate that. This is what I like, when we talk about problems and people who can help solve them, phone in with suggestions. I love that. Salifu is in Kuforidia. Hi, Salifu. Good morning.
Good morning, Kujo. How are you too?
Not bad at all. Thanks for calling, Salifu.
Okay, sir. I just want to ask or tell the pharmacy that most of their people in the stores, when you go to buy medicine, when you have a prescription to them, they don't take their time to explain to us what the prescription is. They just give you the medicine, that's all. So they should always try to ask how we take it, the dosage, and then how it works, the number of hours it will, or whether you should relax or you should do anything. Thank you.
Thank you, Salifu. Thanks for the suggestion. Let's go to Kumasi and take one more call before we come around for answers from our guests. Ken is in Kumasi listening to Love FM. Ken, good morning.
Good morning.
Talk to us, my brother.
I think FDA should have been the first point of call, but it seems like they are not doing their job. So, for that matter, the pharmaceutical shops are the ones to help us, because they are those that go for the drugs. And then when you go for a drug and your customer find out that the drug is fake, I think you are collapsing your shop or maybe your way. So the best thing is for them to make a thorough investigation about the drug that they are purchasing before they come out there to sell to us, the customers. And for me, I think I'm not concerned about those who manufacture the drug. So anytime I'm buying a drug, I just look at that first before I take it home. And my question is, I want to know, when you buy a drug and it's fake, what do you do? Do you have to, attack or confront those who you bought it from, or you have to take it to another level?
Okay, what do you do when you find that you've bought a fake drug? We'll get you an answer to that question. Thank you so much. So let's get straight into it. Our guest to help answer our questions, Kwame Sapon-Siedu, is from CDD. He's a pharmacist. Festus Krang is with the Ghana Pharmaceutical Traceability Strategy at the Ministry of Health. And Mr. Vigil Edward Praishen is Head of Enforcement at FDA. All right, so let's get started. Mame's question was this. Do pharmacies not have a responsibility to check what they are selling to us? Should they not be investing in such solutions from their own resources?
No. Pharmacists, the profession, the motto is Friends of the Human Race. So we have a responsibility to the human race and Ghanaians as a generalization to ensure that what we sell to them is genuine. If you listen to Mr. Cran from the start, that is why a pharmacy ordinarily should not get a product from anyone who is not a registered wholesaler and holds a wholesaler's license, or from a registered manufacturer in the country. That is as far as you can go by guaranteeing the supply chain authenticity from authentic sources. To say invest in the digital space is a very difficult proposition, especially when the directory I was talking about doesn't exist. What are you investing in? Because the FDA holds that repository. The repository hasn't been converted into a searchable one. So where do you invest in the first place? Are you saying the pharmacist, or to that end, the Pharmaceutical Society of Ghana or the Pharmacy Council should pay for the conversion of that database? And I heard a lady say from their profits, this is not something you can do on an individualized basis from their profits. So, yes, there is a responsibility from getting authentic products from authentic sources, but no, it's beyond the scope of the community pharmacy to go into that investment.
If that data was available,
then yes, and that is why I'm saying that then the traceability onus is being put on the community pharmacist. And that was why I gave that analogy I gave earlier about converting it into a searchable engine, because then you've given them an extra tool. So in that case, if even a pharmacy inspector from the Pharmacy Council went to your pharmacy shop, picked something from your shelf, and found that it wasn't registered in Ghana, they can hold you personally accountable, because you have the tool to have checked when you got your stocks from your wholesaler, whether they were authentic or not. And then they can ask the secondary question, did you actually get it from a wholesaler? Where are your invoices? Because maybe you have been unscrupulous and have bought it from someone who came with a briefcase. So these are the things, and that is why I think the directory is a game changer.
So this also answers Oko's question, who was asking, why don't pharmacists just tap into M-Pedigree, for example, and use it? M-Pedigree cannot function unless it is plugged into the national database.
Well, yeah, at the end of the day, you need the regulator's permission and all these things. I mean, and that's why it has to be a joint-up strategy, and that's why I'm happy with the Ministry of Health way of going. The only thing is that perhaps they need to up the ante a bit.
All right. Okay. Kwame wanted to know whether we can't mobilize university students who are studying pharmaceutical, who are studying anything to do with, pharmaceutical disciplines, to go and analyze drugs on the shelves for the FDA.
Well, the truth of the matter is, now I'm putting on my head as a former lecturer.
Actually, if you don't mind, just before I hear from you, I want to hear from Vigil on this. If he's on the line with us. Is Vigil on the line?
Yes.
Yes. Yeah, that was a suggestion for the FDA. What do you think of it?
Analyzing drugs goes beyond just taking samples from the shelves and testing. I mean, we have officers who are already doing that. And, sometimes there's need to do further check. And that's sending the samples to the lab to do a confirmatory test. So it's not just taking on the shelves and testing.
Okay. But since you already have a database of, all the barcodes of these drugs and so forth, you have determined which ones have come in through the FDA. Can you not just send people out there with, that information, that database, to check drugs against it?
We do have a database. Even if you go on our website, like my colleague was saying, that we should have a website where the pharmacy can check the registration status of products. We already have that. And I want to just say that maybe we need to educate them the more, so that, these are things that we already have in the system that we are not making use of. And I believe if we start making use of them, we can reduce this issue of substandard and falsified medicine to the lowest minimum.
Correct me if I'm wrong, but my understanding of this 5-year project is that they are trying to get to the point where they can do what you are saying people can already do on your website. Am I right?
Yes, that's very correct. But, it's just the 5 years.
But you are part of this project, too, Mr. Preshen.
I am part of the project.
And you know that the solution is already on your website. So why are you engaging in this project?
Like I was saying, what the traceability system is doing is just to complement what we already have. We just an improvement of what is already in existence. So I wouldn't say that because we already have the information on the website, we should just leave it as it is. How many of us are aware of what I'm saying? I don't think we have a lot of people who have that information. So with the traceability, the way it's being handled, I think the public will get to know more about all these issues of looking for or authenticating drugs, So I think traceability will help us solve most of these issues of substandard and falsified medicine. Although it's not going to tell us about quality, but it will give some sort of assurance to the supply chain system.
Okay. Victor wanted to know why we look down on tech in this country, because if this database was out there, people could come up with their solutions. Mr. Krang, have you had private, people come up to you and offer to help your project with their know-how, as long as the data can be made available to them?
Well, we've not received anybody currently. However, we are aware. As a mother ministry, we are aware. That's why we're coming out with the policy. And I wouldn't sit here and do advert for somebody. In fact, the gadgets he's trying to talk about, we are aware. But we are aware of others too. Some have approached the minister. The minister listened to them and directed them to the FDA to also listen to them. But what the minister don't want is for him to be gate crash into something we really are not on top of. Because there are many of these gadgets are there, not only from one group, from different groups.
So
and
hire
they've approached
experts
us.
to assess them, open a tender,
Exactly. And it takes some time.
5
We
years.
just don't call them. We said 5 years. It doesn't mean that 5 years. But we've given ourselves 5 years to ensure that everybody is on board.
Children
But
are dying. 1/10 of deaths caused by fake drugs.
We will not be gate crash. Like I said, we won't do advert for anybody. We know there are gadgets. We know there are other people. Other groups of companies have come. The minister have listened. The minister said, go to FDA. Let FDA listen to you. Then FDA will come out of their assessment. We will sit down and go through the procurement process. And then we'll see who is best placed to carry out this activity for us.
Okay.
Yeah.
Salifu had some feedback for pharmacists. He said you should explain medication better to your patients. And then Ken also said pharmacists should help. Fake drugs are bad for your business, but I think you've dealt with that already. And then he says, look, what do I do if I find that I have fake drugs? Bought a drug and it's fake. I'll get a quick response from Mr. Vigil on that, and then I'll get a final word from Kwame. So, Mr. Vigil, what's the procedure at the moment? If somebody finds that they've got fake drugs, what do?
Yeah, you can walk into any of our offices. We have offices in 10 Reading. You can also, we have a lot of phone numbers that you can just call. We have a toll-free number. You can call on that as well. We have WhatsApp contacts and all that.
Do you have these numbers, or do you have a website where we can find them all?
Yeah, you can get this from our website.
So your website is what? fda.org?
fda.gov.gh.
.gov.gh. Thank you very much for that.
You can easily get that from there.
Okay, Kwame, we're going to have to wrap up with you at this point, going into the future. If a customer walks into a pharmacy today, anything at all they can do to reduce their risk of buying a fake drug?
Request to speak to the pharmacist. I mean, that is it. For me, it's about requesting to speak to the pharmacist and trusting the judgment of that pharmacist to be professional enough not to get things from the wrong side of the supply chain.
All right. I want to thank you all so much. We've learned a lot from our guests, not least of which Yinjinan Kremund, right? Mr. Kwame Sapon-Asiedu, of course. Dr. Kwame Sapon-Asiedu is a D&D fellow on public health at CDD Ghana. He's a pharmacist, member of the Royal Pharmaceutical Society in the UK, and he's a member of the Pharmaceutical Society in Ghana, as well as the Institute of Pharmacy Management International. Mr. Festus Krang is coordinator at the Ghana Pharmaceutical Traceability Strategy Project, which is at the Ministry of Health. It's a 5-year project. Vigil Edward Pra-Ishen is head of enforcement at the Food and Drugs Authority, the FDA. Thank you all so much.